We do have to talk about drugs that affect memory, because sometimes people think they have cognitive decline and it's actually a drug that they're taking. And a well-known side effect of statin drugs is cognitive decline. And for some people, it can happen so quickly that within a few days, it's like they've degenerated into Alzheimer's disease. And it's now listed as one of the top side effects of statin drugs. Eating grapefruit can make it worse, and in combination with other drugs that cause the same kinds of problems, a person can appear to have fallen into dementia. So it's another reason to stay away from statin drugs unless you happen to be in that tiny percentage of the population that actually benefits from taking them. Antidepressants block acetylcholine and cause confusion, clouded thinking, and memory lapses. And if you take them in combination with allergy medication, which also has the same effect, it exacerbates the effect. So that would be some good reasons to not start taking or to think about withdrawing from psychiatric drugs. Antihistamines, anxiety meds, painkillers, opiates, blood pressure meds, acid blockers, alcohol, cannabis, and opiates, all things that contribute to memory loss. Some of them are obvious. I don't think most people think alcohol enhances your memory, but some of them less obvious, like blood pressure meds and antihistamines. So medications all have side effects, and sometimes they're necessary. Most of the time they're not necessary, but you should look at risks and benefits. That's part of the informed decision process, is to look at risks and benefits and decide, is the risk I'm going to take worth the benefit I'm going to get if I actually take this drug? Now, I'm going to give you an incentive to pay attention to diet and lifestyle and staying intellectually engaged and mental stimulation and reading and all the things you can do, exercise, to keep a really well-functioning brain. Aricept is a drug that is used for Alzheimer's patients. This is what happens to you if you don't do the right things. Improvement during clinical trials, it showed a 2.7-point improvement on a 70-point scale measuring cognitive function. Well, that'll change the world for you, won't it? It increases the death rate. In one study, 11 patients taking the drug died while none in the placebo group died. It's a blockbuster drug, $2 billion a year. And it's not because it works, because it doesn't. It's because patients and their families are so desperate to find help, and they don't read anything about this, and they take this drug. And it increases the risk of dying without really improving cognitive function. Now, another reason why you need to be informed is to know what goes on at places like the FDA. It was scheduled, Aricept, to lose its patent in 2012, but Pfizer got approval from FDA for a higher dosage of the drug in order to extend its patent. It was granted. In a clinical trial involving 1,400 patients, higher dosages caused dangerous side effects like nausea and vomiting, while not improving cognitive functioning in people with moderate to severe Alzheimer's disease. Dr. Russell Katz, the head of the FDA's Neurology Products Division, approved the drug in spite of its limitations and said that the side effects, quote, could lead to significant morbidities and increased mortality. So I don't know in what universe this is okay, where Pfizer makes a drug that doesn't work. It's going off patent, so it increases the dosage to extend the patent. The FDA knows that it kills patients and says, well, we're going to approve it anyway. And so this is a reason why I encourage informed decision-making, because I think people really should look at these kinds of things. And I'll say something else, too. I am so sick and tired of hearing people talk about lazy Americans who don't want to do anything about their health. The fact that you people are here shows that that's wrong. That's simply false. But the other thing is, lazy Americans aren't well informed. And if doctors were forced to show data like this, I think people would be incredibly motivated. So one of my goals, it's the reason I have to live to be 105, is I think that we should have federal laws that punish people in healthcare who don't fully inform patients about the risks and benefits of everything that they do. If you can go to prison for lying to people about mortgage loans, you should go to prison for killing people with drugs like Aricept. Okay, so here's the best strategy for all of this is prevention. Now, having said that, and those are the things we've been talking about, diet, exercise, sleep, mental stimulation. Really, the brain is like everything else. Use it or lose it. At the earliest sign of decline, it's shocking what a great effect some of this stuff can have. And I'll give you an example. We had an 85-year-old woman who was clearly sinking into cognitive decline. This was a person who was a member many years ago. And her situation, she was so unable to participate at the time that the phone call that we had with her and her daughter, she was living with her daughter at the time, she said nothing. The daughter and I carried on this conversation, and we put together a plan. There were several problems. Her mother was dehydrated. Her mother wasn't eating enough food. Her mother, they had moved to another city for the daughter's job, and the mother didn't know people, and she wasn't exercising. Well, we put together a very comprehensive plan, and it involved eating better and hydration and joining a church and getting involved in social activities and going to the senior center for exercise and the whole 9 yards. And the thing that was amazing was over a period of several months, I watched this woman come back alive mentally to the place where she had conversations with me when her daughter wasn't even home. And she lived to be 93 years old and lived on her own. She was never committed to any kind of memory care or nursing home. And so at the first sign of problems, it takes people, people on their own, and this is the difficulty that some families have because people scatter now, everybody's not in the same place. So it requires some intervention that involves people. But if you can get active and do this type of intervention in the beginning, you can turn things around. There's only one study that I saw that showed this result. It was small, lots of things wrong with it, but basically a group of people who had been diagnosed with early stage Alzheimer's got involved in just such a multi-pronged intervention program. Two of the people had to quit their day jobs because of their mental function. Both of them went back to work, and 100% of the group showed improvement. So we need some more research like that, but there's no reason not to try these kinds of things because there's nothing harmful that can come from them. Diet by itself won't reverse early stage Alzheimer's. You have to do this very comprehensive approach. But you can slow the progression, sometimes turn it around, but the best thing to do is to start protecting your brain right now. And one thing I'll mention, I was having a conversation with somebody else earlier today about this issue, and we seem to have, we humans, some understanding of the need to take care of our stuff. Have you ever noticed that? Like, have you ever been to somebody's house where it's like raining inside? And they say, oh, that, I know, the roof needs fixed, but I am so busy. Have you ever been to some place like that? No. Have you ever seen somebody driving on a flat tire for months at a time going, I know this is not good, but I have 3 kids who play soccer, right? People seem to understand you can't do that, right? You can't maintain your house that way. You can't maintain your car that way. We have got to get to the place where we understand how important it is to maintain our bodies in an appropriate way. And it is really devastating to us, to our families, to our communities, when we fail to do the things that we should do to take care of our bodies the way we take care of other things we care about. So thank you for listening.